You finish brushing your teeth, you lean over to rinse, and you see it. That unmistakable tinge of pink in the sink. Your first thought is probably, I must have brushed too hard. Many of us dismiss it as a minor issue. But what if I told you that bleeding gums are almost always a distress signal? It's a sign that something deeper is going on. Welcome back to the channel. Today, we're moving beyond the simple excuse of an aggressive toothbrush. We are uncovering 5 common, and sometimes shocking, underlying reasons why your gums are bleeding. Stick around for reason number 5, because it's the one most people, and even some dental advice, completely overlook. Reason number 1, the usual suspect, gingivitis. Let's get the most common cause out of the way first, as it's the foundation for everything else. Gingivitis is the earliest stage of gum disease, and it's caused by the buildup of plaque. That sticky, it's invisible film of bacteria. Along your gum line, when plaque isn't removed by proper brushing and flossing, it hardens into tartar. This buildup irritates your gum tissue, causing inflammation. Inflamed gums are swollen, tender, and they bleed easily. Think of it like a tiny splinter under your skin. The area gets red, puffy, and sensitive. That's what plaque is doing to your gums. While common, it should never be considered normal. It's the first major warning sign your body gives you. Reason number 2, hormonal fluctuations. This might surprise you, but your hormones can have a massive impact on your oral health. During periods of significant hormonal shifts, like puberty, pregnancy, menopause, or even during a monthly menstrual cycle, your gums can become much more sensitive. Increased hormone levels can boost blood flow to the gum tissues and change the body's response to the bacteria and plaque, making you far more susceptible to inflammation and bleeding. This is why pregnant women are often diagnosed with pregnancy gingivitis. Their oral hygiene routine might be perfect, but the hormonal changes make their gums overreact to even small amounts of plaque. Reason number 3, nutritional deficiencies. Your gums are living tissues that require a steady supply of specific nutrients to stay strong and healthy. If your diet is lacking, your gums will be one of the first places to show it. A classic example is a vitamin C deficiency. Vitamin C is absolutely crucial for producing collagen, the protein that keeps your gums firm and resilient. Without enough of it, your gum tissues weaken and become prone to bleeding. Similarly, a vitamin K deficiency can be a culprit, as this vitamin is essential for blood clotting. If your blood isn't clotting properly, even minor irritation can lead to bleeding. This shows that what you eat or don't eat has a direct effect on the health of your mouth. Reason number 4, underlying medical conditions and medications. Sometimes bleeding gums can be a signpost for a health issue elsewhere in the body. Conditions that affect blood clotting, like hemophilia or von Willebrand disease, can cause significant gum bleeding. People with diabetes are also at a much higher risk for gum disease, because elevated blood sugar levels can weaken blood vessels and compromise the body's ability to fight off infections. Furthermore, certain common medications, especially blood thinners, like aspirin or warfarin, are designed to prevent blood clots and can naturally make your gums bleed more easily. This is why it's always important to view your oral health as part of your overall health and to speak with a doctor about any persistent symptoms. Reason number 5, the hidden systemic cause, poor oxygenation and bacterial load. Now we arrive at the reason I mentioned at the start, the one that connects everything. If you're doing everything right, but your gums are still struggling, the issue may not be localized to your mouth at all. The problem may be systemic. As we've explored before, your gums need a rich supply of oxygen, delivered by healthy blood flow, to stay strong and fight off infection. When circulation is poor or the blood is not optimally oxygenated, your gum tissues weaken. They become breathless and frail, making them extremely vulnerable to bleeding, even from minimal provocation. And where do the bacteria that provoke them come from? Of course, from plaque, but also from your interconnected airways. A high bacterial load in your respiratory system can create a state of chronic low-grade inflammation throughout your body, putting your immune system on constant alert and making your gums overreact. It's a double whammy. Your gums are weakened from a lack of oxygen, and they are being perpetually challenged by bacteria from multiple fronts. This is the deep underlying reason why, for so many, just brushing and flossing more isn't enough to solve the problem for good. So, what's the takeaway? Bleeding gums are a complex issue. While you should absolutely ensure your brushing and flossing are on point, you also need to look at the bigger picture. If you suspect reason number 5, a weakened system and poor oxygenation, is playing a role in your gum health, it may be time to support your body from the inside out. To truly fortify your gums, you need to think about enhancing oxygen flow and managing that systemic bacterial load. I've linked in the description to a very unique approach designed to do just that. Formula that supports gum and tooth tissue oxygenation while helping to cleanse the airways. It could be the missing piece of the puzzle for achieving truly healthy, bleed-free gums. Thank you for watching. If this video helped you understand your gum health better, please give it a thumbs up and subscribe for more essential health insights. And I want to hear from you in the comments. Which of these 5 reasons surprised you the most?